Oh, sorry.
Hello, everyone. Welcome. We're just going to give it a minute or so just to let some more people join us. And if you are here, if you could just mute yourself, that would be great. And then we'll get started in just a minute. Okay. I'm just letting a few more people in.
Every night before I sleep, I think about it.
Okay. So I'm sure some of you might be on your lunch break. So I think let's start with intros and get into the topic, and then we'll go from there. So thank you for coming. My name is Julianne. I am the Director of Outreach and Communications at Chesapeake, the Chesapeake Center for ADHD Learning and Behavioral Health. And we are so thrilled to welcome you all to what we hope to be the first of many Ask the Expert webinars. I am here today with Dr. Jennifer Reisman. She is our Director of Assessments. She's a neuropsychologist at the Chesapeake Center. Just before I formally introduce her, this will be recorded, and so we will be sending you a copy of the recording after. And if you have questions throughout, feel free to throw them in the chat. I'll be monitoring that, and then we will also have time at the end where we'll do a Q&A, kind of more of discussion if people want to stay on. So Dr. Jennifer Linton Reisman is a board-certified clinical neuropsychologist, and she has subspecialty certification in pediatric neuropsychology from the American Board of Professional Psychology. She specializes in providing accessible neuropsychological assessments to individuals who are deaf, hard of hearing, or affected by some type of hearing loss, and provides evaluations and consultations in American Sign Language and English. Dr. Reisman was a member of the American Psychological Association Task Force on the Guidelines for Assessment and Intervention with Persons with Disabilities. And after a decade in practice as a faculty member at the Johns Hopkins University School of Medicine and the Kennedy Krieger Institute, she is presently the Director of Training at the Chesapeake Center. She also co-authored a new textbook that will be released in September called Neurodevelopment in the Post-Pandemic World. And it's going to be published by the Oxford Press, and it's a textbook that really dives into how the psychosocial disruption associated with the COVID-19 pandemic altered the developmental trajectory of a generation of youth. We are thrilled to have her go over this topic and dive into the world of child assessments. And without further ado, Dr. Reisman, I'll pass it along to you.
Fantastic. Thank you so much for that lovely and warm introduction. And I just want to say a really warm hello to everybody who is joining us and talking about a topic near and dear to my heart. When Julianne introduced this topic to me, I said, this is fantastic because one of our main goals is to make sure that at the Chesapeake Center and also just professionally, that we make sure that children are getting the right assessments to fit their needs. And so that's why we wanted to talk a little bit about demystifying different types of assessments and to really try to help families connect with the type of assessment that is right for them. There's no neuropsych kickback that I get for doing this type of presentation or anything, but I do get great joy in terms of making sure that families get connected with the right resources. So I'm going to share a screen. We do have some slides here today to be helping guide us through our talk. But we are also going to be asking you to bring your questions. And so I hope that you do feel free to drop those in the chat. I'm really grateful to Julianne to be managing the chat for us today. And so a little bit about myself. So I'm a neuropsychologist, as Julianne introduced myself. My superpower is I'm really good at making my teenage daughter's eye roll. And I would say I have Riz. She would say that I shouldn't say that word in front of you. So I'm very glad that you can all witness that I actually said that and nobody cringed, at least not that I can see. And Julianne is our head of outreach here at the Chesapeake Center. And her superpower, as I've witnessed many times, is connecting families to the right resources. And I know whenever I have a community resource question, she has connected me many times and families that I work with to the right resources at the right time, which is a fantastic skill. So one of the big questions that we wanted to start and frame is talking about, does my child actually need an assessment? And so if you're on this, call and topic and thinking about it, whether it's you yourself wondering about a family member, or if it's, working in a professional capacity, I think there's some things that I think about as red flags and pink flags for whether or not an assessment is needed. Sometimes there's a red flag. There's an actual change in my child's development, or there was an injury that happened and there's been a dramatic change in status. And so I've been told that I need an assessment, or that my child needs an assessment in order to go and access services that I need, to determine if there's a disability present, to make a new plan, right? If the plan that we've been following and going on isn't working for us anymore. Then there's also the pink flags, right? And I'd be remiss if I didn't address that there is definitely, and I can see it in my clinical work, and I've seen it as a parent as well, there is your gut as a parent. And I can't tell you how many times I've sat down in a clinical interview with parents when I'll say, okay, so when did the pediatrician notice that, so, your child's walking, talking, or development was otherwise slightly off course? And it's usually about a good 6 months later after a parent said, this is when I knew something was not right. And maybe I started talking about it, or maybe I didn't start talking about it. And certainly we know, Julianne and I have had the pleasure of visiting with many pediatricians' offices. We know that lots of pediatricians in our community are in a job of providing reassurance, because there can be lots of things that can cause us anxiety and stress about our child's development. So sometimes we need reassurance. Other times, though, there are some things that are pink flags. And when we start to see multiple pink flags regarding a child's development, not the red flags that say, oh yeah, my pediatrician has said, go get an assessment, but those multiple pink flags that kind of add up over time, I think that's important to notice and pay attention to, and start those discussions, whether it's with a pediatrician, whether it's with a trusted family member, or whether it's reaching out to a center to say, here's the situation I have at hand. Does it sound like an assessment would be useful? I think those are all reasonable steps to take. And then we'll also talk through what are some other situations where going ahead with scheduling an assessment or an evaluation would be a good thing to do. And then there's the question of timing, right? I've definitely heard folks say to me at certain times during the year of, oh, I think my child needs an assessment, but it's too late. And I will tell you that there's not such a thing as a too late, right? Development is an ongoing process. And so if we need to go ahead and do an assessment to figure out what is going on, whether that's a speech and language assessment, an occupational therapy assessment, physical therapy evaluation, neuropsych assessment, an educational assessment within the school, types of things, it's not really ever too late. And I know that especially for parents of teenagers, that's something that we see come into our office sometimes, where I've had parents come and ask us questions and say, well, I wish I would have done this sooner. That's okay. No worries. We can't go back and change the past, but we can change what we do forward. That being said, I will say that timing does matter. And so when we think about the timing of an assessment, there are certain times, right, where a child might be more open and amenable to getting an evaluation. And we'll talk about that a little later when we talk about kind of how to prepare a child for an evaluation process so that they're best able to successfully participate in that. And so there are some things where timing in terms of logistics can help an evaluation process go a little bit more smoothly. But that being said, it's not going to make or break it. So timing doesn't have the type of, oh, it has to be done at this point in time, or it's too late, or we can't look at those types of things. It's really never too late there. And then I also wanted to do some myth busting when Julianne and I were talking about this topic, because we've heard this from families. I've definitely heard, and in working on the topic of the book that we've written about development, especially post-educational disruption, many families feel like, well, all the kids in my child's class are behind in their reading skills or their math skills. So we can't, look at that. We know that they're still catching it from COVID or that period of educational disruption. That's really false. We can objectively take a look at whether or not there is presence or absence of a learning disability. Also, I've definitely heard this one before, and this one kind of goes, I think, to some misunderstandings about kind of IQ, what people call IQ testing or cognitive testing, is that you can't assess a child younger than 6. That's absolutely false. In the office next door to me is Dr. Marcoux, one of our developmental pediatricians, and myself. She and I have a strong affinity and real we really enjoy working with some of our younger children under the 6, our preschoolers and even younger. And so depending on the question at hand, you certainly don't need to wait until a child's 6th birthday or entering kindergarten or entering 1st grade when you have a learning or developmental question at hand, because we do know that there's really strong research that talks about how early intervention can pave the way for a better outcome. So sometimes earlier is definitely better when you're starting to notice or see some difficulties there. Other things I've heard from families along the way is, I don't think my child will be able to participate in an assessment. And to that, I usually say, bring it on. And if you're matching the child to the right evaluation that's needed, it doesn't matter if they can't kind of sit still for the assessment, that we'll be able to match the tools to the child and to the questions at hand. Maybe that means involving more rating scales and more observations. I know my colleague, Dr. Marcoux, loves to do some school-based observations of children because that really helps her in gathering data. So there's a lot of different things that we can do, even if your child may not be able to kind of sit still for what people think of as a traditional assessment. And then also there's this, I feel like sometimes, especially if you've been worried about your child or their development or a particular concern for a while and find yourself running up against roadblocks, this is what I commonly hear from families when they say, I requested an assessment from the school and that request has been turned down. I'm feeling like I can't get what my child needs. That's when I'd say false. There are some more resources at hand to be able to get what you need to get your child's needs met. That being said, sometimes some of our systems, whether it's insurance, as we'll be talking about later, or educational systems, can be frustrating. And so I really hope that today, even if I can't change all of those systems, I can make sure that you have a little bit more knowledge about those systems to be able to work with them as efficiently as possible for your child's behalf. So then I also want to make sure that we cover a little bit about now what, right? Like if you've gotten an assessment and you're talking about what do we do in terms of interventions and strategies, this is where different assessments will be coming up, right? An important part of assessment work is making sure that your child or your family leaves with a good set of recommendations. And I view that as really a roadmap. It may not be the final destination, especially when your child is very young, but we can also use that to develop priorities. What are the things that we need to develop and look to first as a first step? And one of the things I always try to remember is that sometimes you may leave an assessment and feel like, oh my gosh, I was told I need to do all of these different things. You can't do everything all at once. There are only 24 hours in a day. Your child still needs time to be a child. You still need time to be a family and play Candyland and do whatever is most important to you and your family. But if we can find that most important piece, that can often be really helpful so that you can invest time, energy, and effort into focusing on that most important piece that's going to have the most payoff in terms of developmental trajectory later on. And I think another overlooked part of assessment, because many times when folks go seeking an assessment, is they're really looking to get an answer to a question because something isn't going right, or something is challenging, or something's really frustrating, or there's a lot of upset in a system, whether it's the family system or at school or in some other setting where things just aren't working right for your child. And many times that's where kind of all the energy gets focused and laser focused on. One other part of any good assessment, whether that's, OT, PT, speech, all these other things, is there should be some identification of your child's strengths. Every child has them. Everybody has them. And that when we know that, sometimes that isn't our focus going in, but I call that like the nice extra bonus sidecar that pops out as a result of an assessment, is that we can find out some of those strengths, both to bolster and so that your child knows, so that you know, hey, this is what my child's good at. This is what is not challenging for them, because not everything is going to be equally challenging. And as I like to talk with families about different types of assessment, we know that no matter what, even in people who have solidly average range skills in many areas across the board, chances are they're going to have at least a few areas that are stronger than others, and that we can use to develop that to move forward in a more positive direction. And I find that to be one of the most exciting things, especially when I sit down with teenagers, because sometimes they're a little bit either a little bit embarrassed about some of those strengths that they might have, or they're not quite sure about them. And having that validated and affirmed by another person can sometimes be really powerful for them to kind of step into their own and own some of their strengths. It's a really lovely thing to see. So it wouldn't be a good assessment talk if we didn't talk about insurance. And I will also say, Julianne, if there's any good questions that are in the chat that you'd like me to address as we're going, please feel free to let me know at any point in time. And I know that you're doing that before I go into all things insurance, because I know all things insurance is going to be a hot topic.
Yes. And we actually did have a question. I was waiting for this, but it's someone whose grandson needs a neuropsych. It's a 6 month to a year wait list in Arkansas.
Okay.
And then how do we find a resource where the time delay is more reasonable? He's on Medicaid, personal pay is not an option. So we'll kind of dive into all of this right now.
Yeah. Yes. So let me just say, right off the bat, specialists are, and as we know, right, we exist kind of within a very broken healthcare system that can be fractured, that can be siloed, and can be very challenging. I will say, don't be dissuaded by that 6 months to a year wait list. Know that many of those places and professionals are deeply committed to moving children as quickly as they can. And so whenever anyone tells me, I've been told wherever the location is, and I need to see someone, there's a really long wait, my next usually advice is get on that and then make friends, right? And ask if there is a cancellation list so that we can get on that, so that we can do that, particularly if you're in an area where either the number of providers that are accepting Medicaid may be more limited. And that is a very good thing to do. The other important thing I think is also asking about if a telehealth consultation may be appropriate, to kind of get the ball rolling, to do certain things. But we will also talk in a little bit about like telehealth versus in-person, particularly for young children, and the appropriateness of that. But those would be two like off the bat things that I can think of. I'm also happy, just as a side note, as an outreach coordinator is fantastic about connecting people with resources. And I'm more than happy to post this some neuropsych listservs that I'm on as well to try to connect folks with resources as well. But all things insurance, right? So terms to know that a lot of times if you're looking at different types of assessment practices, whether they're within a large hospital setting or whether they're in a smaller clinic like ours here at Chesapeake, in-network versus out-of-network, right? So in-network refers to the provider or to the center. And if that provider is in your insurance network, it means that that assessment or evaluation benefit is covered at that in-network rate, right? If a provider is outside of an insurance network, so many providers have opted because of insurance technicalities, reimbursement rates, the headache of requiring pre-authorization for assessment, have decided to opt out of that entirely, and so are not a part of any insurance networks. Many insurance companies, though, still do cover assessments or evaluations for an out-of-network provider, particularly if that service that you are seeking for your child, whether it's a neuropsych evaluation, speech, OT, something, if you cannot find that service for your child within the network, right? So that's an important thing. I think sometimes, if you can find what you need within your insurance network, 2 thumbs up, fantastic, go for that. That's fantastic. If you cannot, that is a good reason to then contact your insurance company and say, hey, my child's pediatrician or, the specialist that we see for their chronic condition has referred me for this specialty type of evaluation, whatever type of evaluation is, OT, speech, PT, whatever, but I cannot find a provider within my network that is accepting new patients to perform this evaluation. Will you approve an out-of-network provider covered at the in-network rate? That's one great question to ask, because I can say that particularly in regions of the country, or depending on your child's specific needs. So as Julianne was introducing, one of my areas of specialty and expertise, I'm working with children who are deaf or hard of hearing, but this can also be true of children who have visual disabilities, children who have certain chronic medical conditions. If you are seeking a provider or somebody who is specialized and experienced in working with your child's chronic condition, that is an okay thing to seek out. And that is probably, getting better care. And in the long run, as I've often pointed out to insurance companies, saving them money, right? The last thing you want to do is to go and say that this person couldn't answer my question, or they canceled our appointment at the last minute and said that they didn't have experience working with the type of condition my child had. I need to go elsewhere to find that. So that is a great question. If you cannot find what you need within your insurance network, within your area, and available within the next year, it is an okay thing to say, can I get approval for this on an out-of-network basis covered at the in-network rate? And then there's this topic of medical necessity, and this comes up for assessments a lot. So this is where I will say, if there is an assessment need that's become available, one of the first, kind of encouragements or talks that I have with a family is to say, I would encourage you to talk about this with your pediatrician and see if they will provide a referral for an assessment, because many insurance policies, not all. So this is where I feel like I'm always, whenever Julianne and I are consulting about a specific question or case, we have to get into the details and the nitty-gritty, because it's really hard when talking about insurance and different policies to say that this is always true. It's not. So your mileage may vary, your experience may vary, but for many insurance policies, they will look at medical necessity criteria for an evaluation. And so often that involves a couple of different things. One of the first things they usually require right at the top, if someone was filling out a pre-authorization form, so asking permission, asking for the insurance company to cover something in advance, they would ask, who referred this? And sadly, they don't really like it when I have to put down parents. They really like it if it's one of their doctors that say, yes, I've seen this child, and they have all different types of reasons for it. So I can't tell you how many. I can tell horror stories of the things where families that have perhaps had to relocate or move, or they didn't have a primary care, physician at their new location that they moved to, but they knew this child needed to see a specialist. Maybe they even moved to access, better medical care in a more urban area. But I've seen insurance companies refuse it if they didn't have a referral from their primary care physician regarding the need for an assessment. So obtaining a referral is good. The second part is making sure to communicate all relevant information about your child, particularly about their medical history. And why some people look at me as they say, well, why does that matter? If I think my child has an attentional disorder, but they also have neurofibromatosis, or they've also had a seizure when they were a baby, or maybe they had some hearing loss, or maybe, they've had some visual issue, or maybe they have cerebral palsy, or maybe they were born, very premature and they spent some time in the NICU and now it's years later. I'm worried about that. Why does that matter? The why that matters is medical necessity. So whenever we're doing an evaluation, if there's parts of that child's medical history that will help us make the case to an insurance company about why an evaluation is needed, that's really good. That's also one of the reasons why many evaluation and assessment practices, whether it's in a large hospital setting, whether it's a smaller practice, will require some information from a family in advance or ahead of time. It can feel like a pain in the behind. It really can, right? Why are you asking me all these questions? I haven't even seen the doctor. But one of the reasons why they ask all those questions is so that they can submit that information to share to make a case to an insurance company about why a particular evaluation or assessment should be covered and what are the potential reasons there. The other thing is that when we think about often, the difference between a neuropsychological assessment and a psychological assessment, what's the difference? And so I'll cover a few different things. One is that you should know that all neuropsychologists are trained first as psychologists. We're all licensed psychologists. I'm a licensed psychologist in Maryland. In terms of being able to provide neuropsychological assessment and bill under that code, I did need additional specialty training in neuropsychology. So I did 2 years of postdoctoral training. Here at the Chesapeake Center, we actually run a 2-year postdoctoral training program so that we continue to educate others in that practice of assessment. And it really involves the brain and behavior relationship so that we can do that and bring that forward to an assessment. Many of the tests, though, are also involving psychological tests. This is where I have to say, whenever I talk about this to families, to other doctors, or things like that, we all know that this is just a way of kind of piecing up and dividing up our whole human experience really arbitrarily and really falsely, right? We know that, say, for example, psychological assessment or looking at things like mental health disorders are not necessarily different from the disorders that go on in your brain. It all involves the brain. Depression doesn't come from your big toe or getting hit in the knee, right? Although certainly being rested up after having a knee injury or something can make you feel worse. But we know that there is not this mind-body dichotomy. However, that's not how most insurance companies and policies operate, where they may have different levels of coverage for neuropsychological assessment versus psychological assessment. So it's important to know the types of assessment that you are looking at. If you're looking at a neuropsychological assessment versus a psychological assessment, because your insurance company may treat it differently. And when I say that they treat it differently because of a CPT code. Well, that's a CPT code, right? So if you've ever gotten your EOB, your explanation of benefit statement, it usually has on there a listing of a CPT code, right? You went and you saw a doctor, they did different procedures. Maybe it was your child got a well visit, that's its own CPT code. Maybe your child got some vaccines, that's its own CPT code. Maybe they did some brief developmental screening, that's its own CPT code. Same thing with psychological assessments and neuropsychological assessments. They're different codes, okay? So that is important to know in terms of asking what their insurance is going to cover a psychological assessment versus a neuropsychological assessment, because their policies may indeed be different. And sometimes finding out what is covered can be really helpful so that, one, you don't get a surprise bill. Two, that you can make sure that what you need is going to get covered to the maximum extent possible. The other third thing about that, in terms of the CPT codes and psych assessment and neuropsych assessment, is that there's actually certain diagnoses that I cannot pair and get covered with each code. So say, for example, if I'm talking about a child where I'm worried that they have an obsessive compulsive disorder or anxiety or depression or ADHD, all of those codes or those types of diagnoses all fall under psychological assessment or psychology, right? And I cannot necessarily pair them with neuropsychological assessment codes, and that because otherwise they won't get covered. So I need to then be able to talk about other different types of brain-related codes, medical-related codes. So sometimes you might see other diagnoses codes where you go, wait, well, we're talking about this. There are some things that, of course, we just need to make sure that we're documenting and submitting appropriate documentation and diagnostic classification codes that are consistent with the procedures that we did. Okay. And if you ever have questions about that, you should always ask. I don't have any problem when sometimes, when a family is asking me about, well, why did it say this code after my intake? And I have to say, well, because we haven't done any testing for this disorder yet. It's kind of a rule out code. So I have it there as a provisional code. That's why. Or that's the existing diagnosis that we have. We know that we're considering other diagnoses. That's why you might see something different listed, say, for example, during an intake interview versus after testing. So there's a lot of different things that can be going on there. And then maximizing benefits and advocating within your child's insurance. I think it's really important to make sure that you find out what the evaluation procedure is, what they expect they will do, and then find out from the insurance what they will cover. So knowing even some of those language of what are the expected CPT codes that would be billed, that's something our practice provides routinely. Most hospital centers should provide routinely to let you know. And if a provider wouldn't share that information, I would actually view that as a little bit of a concern. That's information that, anyone providing assessments to children would want to make sure that we're talking about this. Julianne, do we have questions about these things?
Yes. So I have two questions for you. The first came directly to me. She said her child goes to a private school. They are suggesting she get a psychoeducational assessment. She spoke with her doctor at Kaiser and was told they don't reimburse. So what are the options in the DC area? So I guess you touched on some of the things that we could do in the situation, but
Yes. So I think that is one of the things. So from the insurance perspective, most insurance policies, not all, but most insurance policies, the minute you tell an insurance company that you are concerned about a learning disability or anything related to the E word, related to education, in the eyes of the insurance company, that is the purview and responsibility of our public school system. And the insurance company does not care if your child does not attend that public school system and is enrolled at a private school that meets their needs that you are paying for out of pocket. They blanket do not cover that. And so that is one of the real and significant challenges in terms of access to services that is just there. I think there are many practices that try to do that. So there's a couple of different options. One option is kind of a analysis of your child's individual situation. Does your child have a medical condition or other conditions that you are concerned about that are not necessarily the educational ones? Or is it purely educational? If there are some other concerns, there is a potential path forward to getting an evaluation covered by insurance, as long as those educational concerns aren't kind of front and center of the issues and not what the psychologist performing an assessment would be billing under, but knows that you are concerned about them. So that's one option. The other option is to request a psychoeducational evaluation through the public school system. I know in this situation, the question that came up is not a child enrolled in the public school system. Depending on the public school system, though, some will perform assessments even for children that are, simply living in the community but not enrolled in the school system to determine if the child does have indeed a learning disability that requires some type of support. There are some template letters that can be submitted to a public school system to formally request an evaluation within the state of Maryland. So because we are physically located in Maryland, the the Maryland Disability Law Center, and also the Project HEAL of the Kennedy Krieger Institute has a fantastic template on their website. And we can include this in our email when Julianne, and when we send out the recording, we can also send out some resources that have things like a template letter to just request an evaluation at no cost to you from the school system. So that is another option. But I think that's one of the more frustrating and challenging things. There are certainly medical examples that I can think of where there's medical disorders that we know are associated with higher rates of learning disability. And certainly as a psychologist, we can look at those, but the billing, diagnosis that I'm going to be submitting to insurance is going to be under the medical disorder, but I'm going to be looking at the educational piece of that, because certainly that's a huge part of our child's experience, is looking at their academic functioning.
We also had some great comments on that. So in DC, DCPS OSSE does private psych ed testing for DC residents, even if enrolled in private or homeschool. And so DC Child Find is the program. And then in PA, you would contact the local education intermediate unit. They provide services for private schools. So I can share these resources as well. One other question for you, Dr. Reisman. So where children are hard of hearing and need to be assessed, is it better to seek out someone with experience doing these types of assessments for hard of hearing children, or do therapists incorporate that and potential externalizing behaviors associated with that into their analysis at baseline?
Ooh, that's a fantastic question. So I will say that there's a balance of two things, and that we'll talk about this as well. So I apologize if I'm repeating myself. When it comes to selecting a provider or figuring out, do I need someone who is truly a specialist in this? Or can I go to whomever is closest to me, right? Because let's face it, time is limited. Our energy for things is limited. And if we have to travel a great distance for an assessment, that's certainly more of a burden on us as a family, more of a burden on our children and everything else. I wish sincerely that everyone could have a fantastic specialty or fantastic access to specialty care within a 30-minute drive of them. But for many parts of the country, that is not the case. Or for many disabilities that may be lower base rate, that is more rare. I will say, when it comes to children with hearing loss or other sensory disabilities, I would like it to be the case that absolutely everyone would feel comfortable with that. I think that's actually a good question to ask this to, ask a generalist provider, to say, hey, you're a therapist or you're local. I would love to, access your services. Do you feel comfortable with this? Or do you have people you could consult with about my child's particular needs? If not, and if the answer is, oh yeah, you may be surprised, right? This may not be the first time a hard of hearing child has walked into this clinic and needs that. Or this may be someone who says, oh, I know who I can call. I'll call Jen Reisman, or I'll call Danny Prevy, right? Any of my colleagues that I've trained that I know who are out there and fabulous, and that we'd be happy to consult and get, coordinate some great care closer to home. I love it when that works out. I've also seen it work out not great. And where, I've seen a child where they were diagnosed with autism, or they were diagnosed with a learning disability in reading and wore a mask, and the child had no visual access to the examiner. Or even worse, when I've seen a child, not have access to their hearing aids, and the evaluator didn't even realize it. And the parent realized it, when they got home and said, oh my gosh, my child didn't even have their hearing aids, and we left in such a rush. Things were, a little bit off, didn't even realize it. And then the evaluator I've seen, refused to redo testing, which to me, I was like, well, no, we need to fix this situation. So I wish sincerely that everyone would be able to access specialty care within driving distance for certain situations. If you're working with an evaluator who feels really comfortable, or who could access consultation from someone specialized in that, 2 thumbs up, go ahead. If the answers to those questions are not to your satisfaction, then it probably is best to look at what's your next closest option to that. Or does it make sense to perhaps get some virtual consultation around that? Other questions on insurance, Julianne, or things that have come up so far, even if they're not on insurance?
Yes. So this is a good question just about criteria. So this is a family med physician who's taken care of an 11-year-old girl since birth. She's had significant school anxiety, sensory processing, social anxiety, selective mutism. Parents are finally willing to have her tested for autism spectrum disorder, but the school says she does not meet criteria because academics and behavioral deficits are not present. Are these criteria for assessment skewed towards more prominent symptoms in boys that are more disruptive in the classroom? And how do you suggest we proceed?
I think that's a great question. And that is a great question. And I think that that's also one of the situations that comes up. So as I was just saying, right, when we have an educational concern and we seek out a psychoeducational assessment or some type of assessment that is provided within the school system, let me just say, I have massive respect for my colleagues in school psychology and school counseling and school social work who work with children within our school system. Massive respect. However, all of those professionals also operate among a framework of systems that in some ways limits what they are supposed to look at. And so when they limit what they're supposed to look at, they're supposed to be looking at the most educationally relevant criteria. So in other words, this child, it sounds like, maybe having more subtle symptoms, maybe having different symptoms, but if they are not creating an educational impact, it does sometimes tie the hands of that team to not look at clinical factors. And that can be quite, that's where I've definitely seen parents, and families get really frustrated because our children don't cease to kind of have needs outside of the school day, right? They leave the school doors and we want them to be having friends, or some of the needs may be more subtle and are not picked up on some of the objective testing. I think particularly as a clinic, as a department, we start to get really concerned about ensuring that for some children where their needs may have a more subtle presentation or where they may not be a behavioral disruption within the school setting, sometimes those school-based evaluations can end up in a more frustrating experience. And it's not because of the ill intent of the professionals involved, but truly because of the framework of that system that says to those school psychologists and others working within that system that they are to evaluate only the educational impact of that child's disability. And so that, I think, is one of the frustrating things, where then it would make sense to say, okay, let's get a consultation outside of the educational system now that we've gotten some of this data. I know one of the things I really enjoy doing here and our team does here is making sure that we don't overtest. I love it if I have educational data or perhaps even some cognitive testing data or maybe even some attentional data from a school, because that means I'm not going to have to require a family's presence for as long in my office to put that child through more testing or pulling them out of school for another day. So if they've gotten an assessment from school-based evaluation services, but perhaps not arrived at that final answer or final destination that it feels like we need to get to, an outside evaluation or consultation could be really helpful. It's a tricky situation. Yeah.
Thank you.
All right. And then I think also one of the things that I just want to talk about, choosing the right professional or specialist, right? There's lots of different professionals and specialists, whether it's, do I have a question about my child's communication or their spoken language only? I'm going to go see a speech therapist for that. Do I have a question about their fine motor skills only? I'm going to go see an occupational therapist for an assessment about that. But no matter what type of IST that you're going to go see, I love to tell people about, how do we all pick? And this just gets to the social psychology and the psychology of human decision making, that most of us, if we just think as adults about the doctors that we like the most, what are the common characteristics of them? They're probably people that you like. They're somewhat likable. You feel listened to or heard. You feel like they have your best interests at heart. Absolutely none of those things that we normally think about when we think about what are the qualities that we like in the people that we go and seek care from. None of them usually have to do with their training, their experience, or the results. So I just put that out there as a reminder that for many of us, like if we ask our friends or family for, referrals, hey, do you know a great allergist? Do you know a great neuropsychologist? Do you know you're going to get the people that are the most likable referred back to you. And that's important. However, I think especially as parents, right, it's kind of our job to make sure that we are getting our questions answered about a child, and that as parents, we're usually willing to put aside some of our feelings for that. And that the likability part is not the most important thing. It's, am I going to be able to get this question answered? However, I would also argue that in the ideal world, most of our professionals would be the best of both, right? Is that always the case? No. But I think it's important to monitor what are your feelings, about this practice, about this place, and also what are the results? What's the training and what's the experience of the person that I'm seeking out to help me answer this really important question to me? I also think it's really important to help think about what are your questions? And that's not something that we often have time to do when we're worried about our child, or when we're worried about a family member, or when we're trying to get the right care. But the more that I think that we can stop and do that, to be able to pare it down into a couple of sentences about, I'm worried that it might be autism. everyone keeps telling me that this is ADHD, but I'm not 100% sure. Or, they've said my child has a learning disability, but it seems like these interventions aren't working. What's going on? And that can be your question. Those are all great examples of questions. And I love it when people bring me the questions. I would also argue that it's important to just stop and listen to yourself as a parent and determine if there's a question that you're too afraid to share, and to share it. And those are when I find I have usually really good conversations with families when I can help. Because otherwise, I don't want you to leave unsatisfied or feeling like we didn't leave a stone, that we left that one. And sometimes it's I'm afraid that this child, is really having a hard time with their social relationships. Are they going to be able to have lasting social relationships and date, get married in the future, have children, whatever it may be, or kind of deep, dark fears? Or question I had in my office a couple weeks ago was, are they going to be able to pass the driving evaluation? What are we going to need to do that? Because this is what my child really wants to do. And I know that they're safe, but there's something getting in the way of being able to do it. What is it? That was the deep, dark question that needed to be answered, more so than do they need extended time on testing? That was the deep, dark question. And I was really glad and honored that they brought that. I also think it's good to look at markers of quality and training and experience. And so, as we were just talking about, psychologists, right, are required to be licensed by the state. Same thing for speech and language therapists, same thing for occupational therapists, psychiatrists, right? You should be able to look up readily and see that that person is licensed in the state that you're practicing in. And then also it's good to look at their training, right? I think that anyone, as we know, right, folks can go off on the internet and call themselves all sorts of different things, but they really should be able to tell you what type of training that they have in the particular specialty area that you're looking for. So I'm, always happy to share about my training. I've got all my diplomas up on the wall, everything else. My postdoctoral fellowship was in neuropsychology. People ask me about my experience with autism, and I talk about the rotation that I did on my fellowship, and then the program that I founded after that to look at autism. And people ask me about my training with deafness. More than happy to talk about that. My time at Gallaudet, my time training other deaf and hard of hearing professionals. And I think you should feel always comfortable and welcomed to ask training and experience questions. So if you ever feel like, oh, I can't ask that, yes, you can. And most of the time, anyone on the other end of the phone or on the other end of the email, they're actually going to be flattered that you cared to ask and to know. So no worry about, there's no question that's kind of too far out or that shouldn't be on their website, right? If someone just says, oh, I have years and years of experience in this, but they don't tell you where or what, well, that's a little bit of a pink flag. Everybody should be able to share that. And then I think also the resources. I think of a couple things. Most people, I think, sometimes overlook the pediatrician's office, but I will say that our pediatricians, our local pediatricians, are a fantastic resource because they see a lot of children within the community. They hear feedback on a lot of different practices, and they also read a lot of different things that come back into their office. So they're often a really, really useful resource. There's also a lot of statewide resources. So our statewide disability centers, there's a lot of different state level resources that exist to connect people with their local resources, and even at the county level. I also think that it is good to ask in our local schools for resources. I will say though that it's great to ask more than one person for some of these things when you are looking to choose the right professional or specialist to help you answer those questions. So don't be afraid to ask. And also don't be afraid to do your research and ask those questions following up on those folks. Any other great questions coming in, Julianne?
I do. I have one, and this is one that we tend to get a lot, or I tend to get a lot, helping people navigate how many or which assessment to do. So many evaluators want full-scale testing, and I totally understand that that would be ideal because the pricing of full-scale testing, but because the pricing of full-scale testing is outside of the budget of so many people, I wonder if there are some neuropsychologists who would consider this dilemma of finances. And of course, after getting some background information, grades, insights, tutoring, all of that, and give a few tests in the battery that seem most relevant. So for example, a child who seems well-adjusted psychologically and socially, but does well in math and science-based courses, but only seems to have challenges with reading. So in terms of the not over testing, how would you answer that?
Gosh, and this is a question that we've had, and I'm so glad that this question got posed. I will also say that this is something where the neuropsychology, I would predict, particularly in psych assessment as well in the future, are going to have a massive pendulum shift because quite honestly, the need right? We've seen a dramatic need, as particularly since the pandemic, of children in need of assessments or in need of evaluations. We saw long waiting lists, and it is simply unethical and unsustainable to keep that up. One of the things that we've done here at Chesapeake, and one of the things I enjoy the most, is working with families to really build a personalized assessment that does not involve over-testing. Here at Chesapeake, we've developed a consultation package that I really enjoy doing with families, where we can build a very specific question, we can collect some ratings, but that we are not, and this is where I will say, there are some families that say, this is not for me. I really want that full scale assessment, or I need that for admission into a private school, or I need that for submission for extended time for the SAT or ACT or something like that. I'm not able to answer those questions with a very focused consultation. But with a very focused consultation, that is indeed what we need to do, both ethically and professionally. So yes, there are a number of neuropsychologists, myself included, that are very excited to do focused consultations with families and don't require a one-size-fits-all. Everybody has to go through a full-scale academic and a full-scale cognitive battery if we can build and tailor a very specific question. But you bring up a great point, because I think that that is one of the challenges that when families are navigating a system, especially if they're finding that they're, hit with a large price tag, or if they're hit with just saying, I'm asking you to come in on like 3 separate days and do all of these things, if that's not what you're seeking. Certainly we have some families that are saying, I want to know that I've left no stone unturned, and I want to make sure that you've really gotten to spend time with me. We can do that. But if you are saying, no, that is not the case, I have this very narrow and specific question that I want to answer, and I want to answer that with some precision, we can also do that too. So I think that is the way of the future. I will also say that within many of our medical clinics locally, that is the way of the future. And I think that many families who just are not, if they don't have a child with that particular diagnosis, they may not be aware of. And I'll just highlight a few things. So within like our congenital heart disorders clinic at certain practices, or within sickle cell clinics, where we know that children are at higher risk of neurodevelopmental outcomes or neurodevelopmental disorders, or they may be at higher risk of psychological dysfunction, where we've built in neuropsychologists or psychologists to work as a member of a multidisciplinary team to do more regular screening, so that we're only referring children for full evaluations who truly need it, and doing it in a timely fashion so that they're not stuck on a year wait list, because that's the heartbreaking thing. I will say that locally it is of concern. And so as a clinic, we've been talking about it because we know that some of our local bigger centers have really bloated their wait lists when it comes to autism evaluations, for example. So that is a big thing.
I have another great question, and this comes into kind of like the timing of assessments and everything. So I did private testing for my child in 3rd grade and got her initial ADHD and anxiety diagnosis, and again in 6th to then get an IEP. When I asked if Montgomery County would then do testing in 9th grade, they said that they would do it in 12th to assist in the college transition process. Would you suggest another private testing in 9th?
Oh, interesting. So I think there's a little bit of a, not necessarily. So if we have a good, strong IEP, I think you can look to do that. Where I think the only thing that pops up sometimes between the 6th grade and 9th grade is sometimes whether or not, if a child has, and this is where there's the like if then, if a child has a strong history of having an IEP or a 504 plan that provides certain accommodations, that's going to be really helpful and useful with agencies outside of the school, whether that's extended time on standardized testing that are outside of the school, or determining what needs might be needed later and outside. As long as that strong, good, well-documented IEP or 504 is in place, you should be set. You shouldn't need another assessment. However, if that's not set, sometimes I have found families in the process, and more so within some of our private schools, less so within some of our public schools, but in private schools where they may have just done informal accommodations and not have developed a formal written plan. But when people have informal accommodations and then say, oh, my child's been getting extended time on standardized testing, now we'd like to apply that to like the SAT. The SAT says, well, where's the documentation of that? And they do want to see more recent documentation. And I believe that they do like it within like the past 2 years or things like that. So that's one situation where if you have strong documentation in an IEP or 504, you may not need testing or assessment until we get to adulthood. So that's actually one positive change that we've seen over the past 10 years, where it used to be those outside agencies and the College Board would request outside testing no matter what, even if you had strong documentation. I call that the disability tax, right? Like, oh my gosh, we have to pull our kids out of school for more time to do this. And that's exactly what we don't. So that's one situation where hopefully you may not need a private evaluation as you transition in 9th grade. Great question.
I think just to piggyback on that. So when we think about like how long is an evaluation good for, I get this question a lot in terms of looking ahead and applying for college. Usually they required updated testing, or what would you say to that?
Yeah, so it really depends on the situation. So for some of our high stakes testing, when I look at entrance evaluations for things like MCAT testing, so the medical college entrance examination, LSAT testing, some of those high stakes evaluations want to be done more recently. I will say that many of those many places, there was also a strange thing. So as current parents may be aware, there was a strange thing that happened during COVID, right? Where nobody could take some of these tests and things like that. And so requests for accommodations were handled very differently. I have definitely seen people get stuck where if during COVID or during a period when many things were online or it was very challenging to get an assessment in person done at that point in time, accommodations were granted on like a temporary basis. And then people get later and they say, oops, I just never went and got that assessment. And now I'm being asked to produce documentation. And that's when I will say that Julianne or our other staff here will get the very stressed out call of, oh my gosh, I've been, accessing these accommodations or supports that have been very helpful, but now I'm being told that I need an assessment. Generally speaking, some of those high stakes testing situations do like their assessments to be done within the past 2 to 3 years. I will just say on record, professionally, I think that's a bunch of bunk and it's a lot of disability tax. It's not something I'm a big fan of, but I'd like to make sure that any family that I'm working with is aware of that so that we're timing anything appropriately if we're looking ahead to different things. Great question.
Thank you.
Yeah. So I think one of the things as we kind of move towards wrapping up our time, I wanted to make sure that we talk about what can we do if you're in the situation of saying, okay, I know my child needs an assessment. I've identified who I would like to work with or where I'd like to work with or the specific type of assessment. How do I make the most out of that? One thing, top one rule, you know your child best. It is good to tell your child. I defer to most parents as to when to tell your child. You've probably told your child about a whole bunch of different things and you know how they react to things. And you could probably have a good idea of how they're going to react to saying, hey, you're going to go and work with someone. One, I usually say, let's make sure that they know that it's not going to hurt. Most of our assessments or evaluations are not going to be, there's no pain, there's no shots. I'm not wearing a white coat for very specific reasons. But it is good. For some of our children that tend to be a little bit anxious, telling them way far in advance may not always work to our advantage. Maybe you want to tell them just a little bit beforehand, but not enough time to get really anxious about it. 2 is to normalize some of that experience. And 3 is to do the things that we would normally do with our children to make sure that they have a good day when they say, go to a new school, have a play date, or are meeting someone new for the first time. Get a good night's sleep the night before, eat breakfast, really important. Another question that we always get, especially when it comes to children who may be on different medications, particularly short-acting medications, is should I take medication on the day of the assessment or should I not? And that's usually, again, it's very hard to say in this line of work that there's a one-size-fits-all answer. It is fantastic to ask the person you're evaluating with what you'd like them to, what their advice on that is, as well as with a prescriber. I'm not a medical doctor, so I can't, but if a child usually takes a specific medication on school days, I'm probably going to want to see them on that medication, unless the question that perhaps the psychiatrist or the prescribing physician has is this medication actually working? Then I may want to split up my assessment a little bit and perhaps, start off without medication and then start, give a break and then have medication on board, right? There's a lot of different flexible things that you can do with that and always ask. And then also, if the best laid plans go awry, just communicate, right? We've all had it happen. We leave out the door, routine has changed. We forget to do the things that we normally do. That's a-okay. Had a family in my office not too long ago where it was, you know what? We told you that something seemed a little bit different and we didn't realize that the pharmacy had completely screwed up the dosing. of the medications. And so that was helpful information for me to have and to be able to share with the prescribing physician who was also wondering about the child's functioning on a change of medication. But we had this third variable at play of different dosage was inadvertently given by the pharmacy. I think it's also really important as we think about like preparation for an evaluation or assessment, how to get the most from some of these things, is that most assessors and evaluators worth their salt and good, right? Good training, good experience. They want all of your outside information. We love it. We will take it and we will try to make it easy. And when I say outside information, things that are relevant to your child, report cards, pesky standardized testing, right? I wish that the schools would communicate it more quickly. Lots of problems with getting MAP testing results to families within a quick manner, but that's still really useful, valuable information. It may not be perfect, right? And I know as parents, sometimes we get really protective about some of that data, perhaps if it doesn't represent our child, but it's all just information. It's all pieces and uses of useful, potentially useful data to just say, how is this child doing at this point in time? Maybe they really didn't get along with that teacher and their grades reflect that. But that's helpful for me to know if I need to make the recommendation that this is the type of classroom situation that your child really needs to do well in, because I've got now evidence about what kind of situation they don't do well in. I think it's also good to gather and share information. And sometimes that means figuring out if I need to have, a trusted tutor filling out a behavioral form, or if I need to get on the phone with someone to get some collateral information to find out about how they did in this particular setting. That's all okay, but think about that in advance. And I think it's also important because some of that information is going to be very helpful in terms of making sure that your child's able to access support inside of a school or in other types of situations. One of our best practices for evaluation is to make sure that we include some school-based information. And some families that I've worked with really have a lot of hesitancy about that, perhaps because their child's had a very negative experience in school, or they're very worried or fearful about how the teacher's perception of a child may be. And so I think it's an important discussion and conversation to have so that you feel comfortable as a parent with about how will this data be used in my child's best interest. Most of the time, right, as someone doing an evaluation, I don't want to do anything that's going to result in a bad outcome for your child. So I'm going to be very mindful and careful about how we go ahead, collect that information and use that information for the future. One of the best things I will say, when a family, just told me that they had been through a lot of change that year, and they said, you know what, maybe the best thing is if we could just show you our Christmas letter for the year. And I said, that's great. Sure. Bring me a copy of it. And sure enough, it told me when they got the new dog, which vacation they went on, when the house fire was, all the different things that like impacted this family and gave me a good way of doing that. So you never know the pieces of information that tend to be the most useful for sharing information. All right. Some examples kind of just illustrative of how to prepare for an assessment. I have had the experience where everybody knew about the assessment but the child. And the child then made it known that they were not happy, that they had to come to my office. I know I tend to be pretty fun. I've got a big treasure chest you can't see up here. I've got a whole boatload of stickers. We have snacks here. We've got fun stuff up here. But please, I do think it is good to make sure that your child does know about the assessment so that we don't have the surprise, this wasn't exactly what I wanted to do, and now we're facing a tantrum, and that's what we got going on there. Another example that I think is instructive to learn from, because I know that this comes from some really good intentions, right? Is that you may have the feeling of, I want to make sure that this evaluator is taking a good, clean look at my child without preconceived notions, especially if you have questions about like, somebody else said this wasn't autism, but I'm not sure. And so you don't tell that or you don't share that with an evaluator. I would encourage you that if you are seeking out an evaluation, you've sought out the specialist that you want, you're getting the type of evaluation that everyone's kind of agreed is a good fit for the question at hand, you don't have to worry about sharing information that's not consistent. That's okay. We see that all the time, right? And it is a-okay to go and seek out a second opinion if that's what is needed. Knowing that there's someone else out there that has come to a different conclusion isn't going to make me look at data differently. It's just data, right? I've respectfully disagreed with colleagues down the hall, in another county and in another state, and that is a-okay. Everyone just has that access to the information that they have at the time. Maybe that person was missing a key piece of information that they didn't know that they needed. That can happen, right? And so What I have seen though happen that's been the horror story, where I will say, in favor of sharing information and bringing it forward, is that particularly with testing situations, there's certain tests where if a child is already familiar with the task itself, it can then end up invalidating the results, or worse, make a school say, I don't want to look at those results because I know that that child took that same exact test twice in a row. As an examiner, as an evaluator, as a neuropsychologist, if I know the child was recently assessed and perhaps there was something that went wrong, perhaps the child got really sick right after the evaluation and it turns out that they just weren't feeling well that day, and so we kind of want to throw out that data. Many of my assessment measures have alternate forms that I can use, or I've got different tests that I can measure the same construct with at the same age range that I could pick so that I'm not potentially invalidating a measure. The last thing I want to do is waste your time. And so I think that it's important to know that sharing that information doesn't mean that, oh, we can't do that. We can pick, we've got Chelsea, who is one of our fantastic folks that helps us manage all of our assessment materials. She loves to just get new assessment materials for us and pack it in there. So, but we've got so many materials to choose from. We've got a giant library. Oh, and then this other one, some examples to learn from. I was sharing this with a colleague, is that what's the meaning of the referral question, right? We've all walked out of a doctor's office sometimes and gotten something handwritten and it says what your child needs. And my best one is figuring out what this means. And it was a provider that I used to work with who wrote down that this family needed a neuropsych TKS. And so this family was on the phone with someone that I worked with, and she came up to me and just said, Dr. Reisman, do you give a neuropsych TKS? And I was like, what kind of special evaluation is this? I don't know what this is. Well, it turns out this is how my colleague signs all of his notes, with thanks, and he abbreviates it because that's how busy his day goes. So just so you know, if you can't read the writing, it may just be that you can't read the writing or that they abbreviate something funny, but never hesitate to reach out to find out what it is that your provider wrote down, particularly if they gave you a handwritten referral, so that you don't get stuck in a situation of calling everybody, finding out what is the neuropsych TKS there. So I think we've left some time for questions and other things there. And I hope that this was helpful and useful, because I know that there's a lot of ground to cover when it comes to, I think a lot of times assessment itself can be a little bit nerve-wracking or a little bit scary. I always remind myself that most of us wouldn't like to end up in my office, and we're not here because it's fun. We have a bazillion other things we'd love to do with our kids, right? We'd love to just be out and about with them and not necessarily in my office. But if you have to, we want to make sure that we're making the most of that time.
If anyone has any other questions, feel free to put them in the chat. I did have one that came through that was pre-submitted, just someone who was wondering the difference between a psychoeducational evaluation and a neuropsychological assessment and when to do either. Or
yeah. And I'm going to stop sharing a screen so that we're not tiny heads here. But I think also when we think about a psychoeducational evaluation that's done through the schools, the really wonderful part of that is that we can then take a deep dive on educational achievement and functioning. We can really look at math. We can answer questions about learning disabilities and reading. We can answer questions about dyscalculia. We really can. One of the challenging parts of that psychoeducational evaluation is that it may not take into account some of the things outside of the school system, right? So if we're seeing more social challenges outside of the school system that may not be interfering within the classroom on a day-to-day basis, that's where that framework of what our school psychoeducational assessments look at from our school psychologists is that they are really tasked with, under the IDEA regulations, to look at things that impact that day-to-day academic functioning. That's one of the things where, particularly for children who might have chronic health conditions or chronic medical conditions where they're followed by multiple specialists outside of the school, some of those, conditions, whether it's they're missing school more often or they're needing some types of therapy outside of the school, certainly can impact their day-to-day functioning, but it may not always be captured within those psychoeducational assessments. In the absolute best case, it's getting a good team together so that you can hopefully limit the burden of assessment on your child, right? I think one of the things that breaks my heart is when I see someone who's, gone through a full outside evaluation and then willingly shares that results with the school, and then the school team decides for whatever reason, maybe it's because the new assessment director is hot to do a ton of assessments or something, and then puts that child through a complete full educational assessment. And then the family is going, they've been pulled out of, the class that they like a ton of times. And that's a really challenging and disappointing thing. I think whenever we can to work together really carefully as a team, I know I'm more than happy to, and many of my colleagues are as well. If we know that a child's IEP team is meeting, I am more than happy to get on the phone and make sure that we're not duplicating effort, and that if a family is willing to share information, that we can let them know, hey, this is the test that I'm planning on giving. If this information is going to be helpful and useful to you, so that you can plan your assessment to limit the amount of demand or time on the child. Or if I know, we've had it come in where, a child